Okay, so here we are. We're talking about the biological aspect of an assessment. So, the importance of gathering biological information is that it does lend itself to being very helpful as far as diagnosis in and formulating a diagnosis in the DSM. And let's go through why. First of all, just as a tip for you as a future practitioner and clinician, get the name of potential medical provider or psychiatric provider that the patient is seeing, get the name, the location, hopefully some contact information, and even possibly a release of information so that you can coordinate care, kind of an interdisciplinary care with that person's primary care or their psychiatrist or other psychiatric provider. And the reason is part of our ethics, part of our responsibility as clinicians is to kind of keep track or help keep track if the client is experiencing any sort of side effects from their medication. Now, I'm not saying that we have to change their meds. Nope, that's obviously out of our scope. However, if we know that they were recently put on a medication, a great ethical and professional responsibility is we can follow up with that at their next session. Just say, hey, I know Dr. Smith put you on, Prozac last week. How's that going with you? Or have you experienced any side effects, or is it helping you? If they say, you know what, actually, yeah, I found that I'm getting massive headaches. I've been very nauseous over the past couple of weeks. Like, I don't feel I can stay on it. That really will cue you in as a clinician to be, you know what, I appreciate you saying that. Let's have you get a hold of your medical provider to, talk about and let that physician know some of those side effects that you're experiencing, because not only can maybe it have biological, physiological effects, headaches, nausea, stuff like that, but even, things such as Prozac and other things can actually impact their mental health. They can start to feel more depressed or tired or, nervous, whatever the case may be. So keeping track of their medical provider or psychiatric provider to be able to reach out to them, as long as you have a release of information to help coordinate care, you could talk to the medical provider and just let them know and say, hey, I just met with your patient. They're my client as well. I just want to let you know that it doesn't seem like they're doing well on this medication. And I'd recommend that they call you. I just wanted to give you a heads up of kind of what I've been seeing, or what the impact it has been from your perspective as a clinician, kind of the mental health changes. All right, so let's dive into the medical conditions portion. This certainly plays a huge role when we're talking about the DSM. And the reason is, so let's focus in here on that. So here we are in medical conditions. One of the main things in formulating diagnoses is to rule out or make sure that the symptoms that you're seeing are not being caused by potentially medical conditions. That's one of the kind of rule out criterias almost with every single mental health diagnosis in the DSM, is to make sure, is this due to a medical condition, or could it be explained by a medical condition? Some medical conditions that I thought of that are pretty common, or things that you'll want to consider, are things such as has the person had significant brain trauma or traumatic brain injury, a TBI? That will definitely, or can definitely, impact their mental health and have psychological impact, to where it's a traumatic brain injury. However, they might act erratic, agitated, delusional, hallucinations, whatever. And so that's something you'll want to know, even if it was in the distant past. Knowing that they have a traumatic brain injury is something that you can factor in, or at least kind of consider. Now, you're not a physician, so you're not going to be able to necessarily connect those two dots per se, but it's something that you want to have in the back of your mind, that maybe it was so severe and they never did get it checked out. And so ethically being able to say, hey, this is probably something you might want, this may be impacting your mental health. I'd like you to follow up with your medical provider to talk about that and see if it warrants any sort of CT scan or whatever it may be, right? Okay, The next thing, so brain trauma, diabetes. There's a lot of studies out there that show that diabetes is very much associated with people experiencing depression. Now, it's not that necessarily diabetes causes per se chemically or physiologically depression, as much as some of the impact that it has on people's lifestyle changes, even physical changes, sometimes the anxiety or nervousness of having to either give shots or insulin, whatever the case may be, lower lifespans, things like that. Some people have amputees due to diabetes, and so it can definitely have significant limitations due to kind of this medical disorder. Another big one, and this is probably one of the most kind of popular ones that is mentioned throughout either clinical tests or just knowledge on biological impact on mental health, is hypothyroidism and hyperthyroidism. Hypothyroidism has to do with lower production by the thyroid, which definitely impacts. Hypothyroidism can impact kind of your lower metabolism, lethargic, meaning you're tired, you lack motivation. It's kind of sadness or depressed mood. You just don't feel like doing much. Hyperthyroidism, on the other hand, there's more of kind of this anxious energy. It's more higher metabolism. There's somewhat more kind of energy, although it's been described to me as almost kind of a nervous energy. And so having them be screened by their physician for any sort of thyroid issue couldn't be critical. I've had clients in the past where I've asked the question, is there anybody in your family with any thyroid issues or have had history of thyroid problems? And I've had clients tell me, yeah, my mom did or my dad did, something like that. I've asked them, well, have you ever had that checked out? And they've told me, no, I haven't. So I've recommended they go to their primary care. That person went, and lo and behold, she was suffering from hypothyroidism. She was able to get put on medications, and her energy increased, her motivation increased, and that really was a biological cause for what seemed to be depression. And in fact, it was a medical condition, and that's why the DSM has that as one of their strict criteria as part of, before you make a diagnosis, you want to rule out, make sure it's possibly not due to a medical condition. All right, carrying on from there. We're looking at things such as menopause and pregnancy for sure. There's certainly hormonal changes during both of those ages and stages of life. That's something that you'll want to kind of follow up on as far as finding out, are they going through that, and are they being treated for that or being helped out with that? For males, right here, low testosterone is a big issue. If a person has low testosterone, and not just for males, let me take that back, even females that are suffer from low testosterone can have, and males can have, a lack of energy. Similar thing, kind of lack of energy, lack of motivation, libido issues for sure, both in men and women, which can definitely impact relationships, kind of quality of life issues. So testosterone is one. Let's see, blood pressure. So people not able to be kind of very active sometimes, potentially because of blood pressure issues. Cerebral palsy, that's certainly for those who have ever had clients or known somebody that's had cerebral palsy, it definitely can have a huge impact physically and mentally, developmentally. And then finally, just as an example, final example is dementia. So if a person is having kind of neurological problems or issues, dementia and things of those nature can cause people to have all sorts of different symptoms beyond just kind of psychological confusion and memory. Sometimes they can become agitated and other type of issues that may appear to be certain types of DSM disorders when in fact it's due to a medical condition such as dementia. So there we go. I recommend asking about or checking on then family history, asking clients, have you had any significant of any of these type of issues or any issues in your family that might be physiologically important to know about. Next thing, as far as just covering, as far as assessment goes, do they have any physical limitations? Do they have chronic pain? Do they have issues with weight, age, mobility, sight, hearing? Asking about activity level is a huge thing. Does their physical limitation keep them from doing things that they previously enjoyed, or even that they probably need to be doing and can't? I have multiple clients that have chronic pain or are overweight, and that definitely impacts their mental health, because their ability to get out and socialize or be active or feel physically healthy or even just kind of physically active is a huge challenge for them. Medications, the reason it's important to get medication history, or at least know and assess the medications, is the fact that also in the DSM, we also need to know that are the mental health symptoms due to a possible substance or medication interaction. And so here we go. As part of this assessment, knowing what medications they're on isn't just like, oh yeah, it's okay, cool, they're on, Prozac, or they're on Lamictal, or they're on, Lexapro, whatever. It's the possible impact on their mental health is what kind of we need to keep track of. It's great to know why they're on it. It's great to know how much their dosage is. But if we're talking about DSM and assessments, really kind of what that factors into is, are these potential symptoms a result of the medications that they're on? And believe me, as maybe you all know and I know, there's side effects with just about every medication you take, and so some of them do impact your mental health. In fact, they can potentially cause you to feel depressed or even feel manic. So all sorts of things that need to be considered when it comes to medications. You'll want to assess sleep, exercise, activity level, diet, appetite. Those are all great parts that we need to look at as part of a biological assessment. If a person's not sleeping right, that's huge. In fact, that's probably one of the main issues that I see with patients, such as anxiety, bipolar disorder, even depression, is their sleep habits and sleep hygiene and sleep routine. If you're not getting enough sleep, your body physiologically can't get any rest. The nerve endings, your mind doesn't get a chance to rest, and so you often find high increased rates in anxiety, high increased rates in depression because they're tired. When it comes to bipolar, if they've been staying up and not getting enough sleep and they're only getting a couple of hours, typically that'll send them into a manic phase or a hypomanic phase where they're having racing thoughts. They can't get their mind to stop because they haven't got any sleep. So those are things that we need to be aware of as well. If they're not sleeping well, let's get them some help by either referring them to their primary care doctor, or let's talk about some proper sleep hygiene with them and see if we can't help them get back to what they feel was their normal sleep habits. Exercise, as we know, exercise plays a large role. And when I say exercise, I'm going to include activity level also. So exercise or activity level, those who are physically active, and it doesn't need to be that you're pumping iron in the gym, those who are physically active and either exercise or get out and even get some fresh air and some sunlight, that makes a world of difference when it comes to mental health. There are physiological impacts and benefits to exercise and activity. The studies bear that out. In fact, with mild depression, it's usually not even recommended that a person be started on any sort of medication for mild depression, because such things as increased exercise and activity level can help that out and be just as effective, really. So that's something to encourage with patients, is to ask them about their exercise level. That also plays into the diagnostic symptoms, because if we're finding out that they're inactive, they're not going out anymore, they're lethargic, they don't have any energy, these are all symptoms that we are gleaning and considering as part of a mental health diagnosis. Diet and appetite, finally. Are they overeating? Are they undereating? As we know, obviously eating too much is going to affect us. can be weight issues. It can be the type of foods we're eating can, again, kind of make us feel a certain way. And that feeling can then affect our mental health, the way we view ourselves, self-esteem. If I've had plenty of patients, and still do, who have struggled with, and because of diet and appetite issues, have struggled with weight and continue to struggle with weight, and that affects their mental health, their self-esteem, which turns into kind of depression, the way they view themselves. So assessing that is critical. And then finally, in the area of biology or the physical side, is substance use. So we've covered kind of three areas here that really play into the DSM criteria for when formulating a diagnosis. Substance abuse is another one of those. So we've talked about, let me kind of check these off. We talked about medical conditions. That's a DSM criteria that we need to figure out and either rule out as part of a differential diagnosis of are the symptoms being caused by a potentially medical condition. Another one is it due to medication and or substances? So these two kind of connect. So substance use. In a biopsychosocial, you'll want to find out, what are they currently, are they currently using any sort of any sort of substances, such as alcohol, any sort of drug use, illicit drug use, or even prescription drug abuse. So you'll want to find out. I usually ask them current and previous use. The reason is if maybe they're not currently or haven't used, for example, meth for the past, couple of months. However, they started 15, 20 years ago. You'll want to know that, because that will explain a whole lot as far as why they are maybe complaining of anxiety and mood swings and lack of concentration and all of those things that can come with, for example, a lot of meth use. A lot of that damage to the physiological nature and structure of the brain is just incredible. And when I say incredible, not incredible in a good way. It's pretty tragic of what happens, and it has an impact on mental health. So that's why substance use and ruling out substance use or finding out the history of substance use can give you a ton of insight into potential DSM diagnostic criteria. If they're currently using substances, that plays into it, because they may have a substance use disorder, or the symptoms, maybe they are an alcoholic or using any sort of drugs, and that is changing their mood, causing anxiety, whatever it is. And so within the DSM, there are diagnoses that are substance-induced symptoms. And so knowing if your client is using any sort of substance is critical. It's so important. So finding out how long and what's their most recent use, those are a couple of questions I ask, right? How long have you used? What's your most recent use? What do you use? What's their drug of choice? Is it drugs, alcohol, both? Is it prescription pills? What type of prescription pills? Have they had previous treatment? Do they have a family history? Those are great things that you can find out about that will help you in treatment planning. But more importantly for this class, we're focused on how can this be used to formulate or be used in diagnoses. Knowing if they're on any sort of substances is critical. That will paint an entirely different picture for you if there's some sort of medication issue or substance issue. All right, we will pause this and move to the next area.